Everyone's Dr. Morales, back at it again. So frequently asked questions related to plastic surgery. This is my opinion and hope it helps you. So the question for this is related to butt implants. And so it's one of those procedures I do quite often. One of the few surgeons in the country that does a lot of them, I would say. Get great outcomes, get safe outcomes, patients are happy, so I enjoy doing it. Those people who are interested in this surgery have researched this procedure extensively. So either you found good information on another website, but I have a lot of information on my website and I hope it helps. So this is a question I get quite often related to the procedure, and is what can't I do after a butt augmentation? And that's a very, very, very important question because things are different once you get butt augmentation with implants. The biggest thing is that most women who are interested in doing the procedure, I would say probably 75% of women who are interested in procedure are very lean. They don't have the body habits to have the sufficient fat to do the fat transfer. So they want a little more volume and shape. And so implants are really the only option. So women who are just a little leaner, I find in my experience, they tend to, they have a history of wanting to work out, and they work out their butt all the time. They're training, and they just can't get the volume that they want and the shape of their butt they want. It just takes years. Can it be done? Yeah. It just takes a long time, a lot of training, and it's really just building your muscle. When you stop doing it, guess what? Your muscle goes back to normal, and you lose that shape and volume you worked so hard for. It's just the nature of the human body. You're just not working it anymore. Butt implants is different. Once you have augmentation, you're permanently augmented. The purpose of training your butt, you don't need to do it anymore. You're augmented. It's just you're done. So as a common benefit, most women are interested in doing the procedure. Choose to do this procedure. My recommendation of things not to do are things that can cause problems with, like flipping the implant or displacing the implant into the wrong position. Very, very, very important part of the recovery. And so for this procedure, I restrict my patients from sitting or laying on their sides for 2 weeks. Your choices after butt augmentation with implants for 2 weeks is you're laying on your stomach sleeping or you're standing. 2 options, that's it. And the purpose of it is for malposition. You can actually change the space and move the space where the implant sits. And the implant space is very, very, very specific to the butt. Like the space is a hand in glove. Like that implant is not supposed to move where I put it. Especially the anatomic shape, where the shape of the implant is a little bit different. So that's a space that's very specific. So I don't want the implant to move where I put it. So if you lay on your sides, or you sleep on your back, or you sit, you push that space into a larger space, and what happens, you get the bigger space, and you can cause the implant not to look right. Your butt will look right. Big problem. So you kind of get the lecture before your surgery, you get the lecture after surgery, you get the lecture even longer after surgery. So the point of not malposition. The women who are very active or in some occupations, okay, and even specific activities I've had experience, I've done a lot of these, I've done over 150 now, is I've had several occasions where women have fell on their butt. Why do women fall? I don't know. Partying, slip and fall on your butt, you have implants, enough pressure in a certain area of your butt and you fall, the chance of you flipping your implant, where the implant actually, in that space that I've created, actually flips in that space, is possible. It is impossible for someone to tell you that you have 0 chance of flipping. That's not possible. There's a space in the human body, there's an implant, it can flip. It takes enough pressure in a certain area, it will happen. It happens less with the anatomic implant. It's more common with the round implant. It's just the nature of the shape of that implant. So the things I tell you not to do after butt augmentation are: 1, be careful. Try not to be in those situations where you fall. I've had exotic dancers who've had their surgery or on a pole and they slip and fall off the stage. I've had that happen. I've had them the same thing, dancing on a chair, slip and fall, laying on their butt, flip their implant. I've had couples have been a little more aggressive, let's say aggressive, during relations, and it just do it the right angle, and it can happen. I've seen it happen. I'm waiting to have someone go roller skating or hoverboarding or ice skating. They slip and fall on their butt. It's gonna happen. I know it's coming. So you want to reduce your risk, okay? So reduce risk if you fall on your butt if you have implants. That's a big deal. So women who are used to training their butt and they want to do squats and leg lunges and jogging and running and marathon runners, I strongly cannot emphasize that you do not do that. Please don't do that. The chance of you creating more space around the implant goes up. You want that implant to stay still. You don't want to move that muscle because for my technique, the implant goes into the muscle itself at the bottom. And so having that constant motion and movement can cause problems, I feel like, in the long term. Same concept that I talked about this with breast implants. For breast implants, I do not want you training your chest because your implants are under your muscle. Over time, with repeated exercise, those 3 exercises I've mentioned before, you can push your implants out to the side of your chest. That is preventable in my opinion, based on my experience of working with athletes who train their chest who have implants. And I've been right so far. Same thing with the butt. If you're running and squatting and jumping and leg pressing, and your chance of moving the implant into wrong position goes up, okay? That's just the way it is. I believe it. I believe it to the core. It's just part of the human anatomy and the way the surgery is done. So those are the things I want to emphasize with you, is that once you have butt implants, please be careful of not falling on your butt. Second thing is once you have implants, you don't need to do butt training anymore. Don't do it. Don't do hip thrusts, don't do leg press, don't do lunges, don't do squats. You don't need to do it. You've been augmented. You have a great butt now. Be thankful. Use that time to go do something different. Go play with your kids or do some more shoulders or back. I don't know. But anyway, that's my honest truth. That's my opinion and recommendations. Hope you learned something if you're considering the procedure. And as always, thank you for following.